Everyone, it's Dr. Brooke Kolisiak of Legacy Physical Therapy. I am going to talk to you about a little bit more sensitive topic today. I am going to talk to you about postpartum pain with sex, which is something that we see commonly here with many of our patients. So I'm here to tell you it's more common than you think, but I want to highlight a particular story, and the patient's name has changed for her protection, but it really kind of brings to light some of the issues that we see when we see our patients with postpartum pain with sex. So I'm going to start out by telling you Sarah's story. Sarah is 8 months postpartum with their first baby, and since having the baby, when she got the green light at the 6-week checkup that everything looked good from her OB, she was able to resume normal activity and to go back to having sex with her husband. Unfortunately, when she tried having sex with her husband, it was painful, and they tried a couple times and it really didn't get better. So she called up her doctor's office and went back in, and her doctor told her that she had some scar tissue there and that, just give it time to heal up more and it'll get better. So Sarah did just that. She went back home, but it never got better. She continued to have excruciating pain with any attempt at sex, right around the vaginal opening there. And so she went on and she sought other opinions and from other medical providers. And in total, she saw 4 different doctors before we actually got to see her here. And all of the doctors told her roughly the same thing, that she had scar tissue there, but none of them gave her any type of treatment options for what she could do about it. There was one that did offer a treatment option of giving her some numbing cream, some lidocaine cream, and then told her to go home and have lots of sex to stretch it out. Okay. To me, that's not probably the best way to go at it, and Sarah didn't think it was either. So Sarah actually was referred to us by a friend of hers to say, hey, maybe you should try out pelvic physical therapy. And so when Sarah finally got to us, she was 8 months postpartum. So she had been suffering with the painful sex for 6.5 months now. Okay. And it was scar tissue that was causing some of the pain. And that's a common thing that we see here at Legacy, is that people have scarring from their deliveries, and this can be in relation to a C-section, having abdominal scarring, or from a vaginal delivery and having scarring either from tearing or from an episiotomy. And at the evaluation, it was determined that scar tissue wasn't moving that well. That was the painful part. And we very easily and quickly got her on a gentle stretching program to progressively desensitize the area and introduce more and more stretch to the vaginal scar tissue. And happy to say that Sarah, in just a couple visits, is doing much, much better. So, that's a kind of happy ending to the story, but it's a story that we hear all too commonly here. And it kind of breaks my heart that women can suffer with this for so long. She was 8 months postpartum before she actually got the help that she needed, and she wasn't actually directly referred to us from any of the 4 physicians that she saw. She only got to us because her friend recommended that she go see a pelvic physical therapist. So that makes me sad, because I guarantee there are many OBGYNs out there who are having patients tell them about their painful sex that they're having after they've had a baby. And I have heard some horrific things be told to women. My personal favorite, as the worst, is just drink a few glasses of wine and get drunk and it'll be fine. So that has been given as medical advice. I've had many patients tell me that's what they've been told. I've also had patients be told that, yeah, you had a baby. This is going to be normal. You're just going to have to suffer through it. This is how it's going to be. And I respectfully disagree that that is how it's going to be. So I'm here to tell you that you can make changes to the pain that you're having with intercourse, and oftentimes by simply partnering with the pelvic physical therapist, it can get you in the right direction. Because what we find most often here is if women are dealing with pain with intercourse after delivering their baby, that it's almost always related to scar tissue or muscle spasming, and that there are very simple things that we can do to try and help that out. So I recommend that you don't wait, because one thing we learn here is that if we get started early on, that it can make a big difference. So we don't want to just wait and see, and then it be 8, 10, 12 months later before you're coming in. Oftentimes what we see is women come in to see us at about the year postpartum mark, because they got the green light when they were 6 weeks postpartum from their doctor. They went home, they tried intercourse, and it didn't work, and it felt painful. So they went back to their doctor and told them that it was painful. And the doctor maybe just said, give it some time. You just had a baby, or, my personal favorite, go home and drink a glass of wine, and that'll make it better. You just need to relax. And so the women have gotten that advice, and then so when it continues to be painful, they don't feel like going back to the doctor is going to be that helpful, because the advice they got last time wasn't that helpful. So they don't go back. And oftentimes they suffer with it until about a year postpartum, when they go back for their annual appointment. And then they may bring it up at that point. And I'm not saying, there's definitely things that can be done as far out as several years postpartum, but we can get quicker results and get you back to feeling yourself and having pain-free intercourse quicker if you come in sooner. And so partnering with a pelvic physical therapist fairly soon on after you notice the symptoms can get you the best benefits out there as far as getting you back to having pain-free sex with your partner.